Hi, Jody here for Journal 3. 3-minute video, 3 to 5 minute video describing an event and a patient interaction that you experienced anytime in your nursing career up to this week. Discuss the impact it had on you in terms of increasing your understanding of the PMHNP role, psychotherapy, or provider-patient relationship. I had a patient, and it was probably one of my last shifts in the ER, and I just got my family nurse practitioner actually, and I was leaving the ER. And I had a patient who was the son of somebody who worked in the ER, so they called and asked if I would, see the patient in triage, and I did. And he came in and he was in trouble for selling drugs, but we don't really know if he was actually selling drugs. We're not sure. No one actually knows. Anyway, he came in and I did the drug test and talked to him for a little while. But, that interaction was not brief. It was for a while because his parents worked in the ER. His mom was the chief. So he was there for a while. We did the drug test and the drug test came back negative. I, at the time, did not understand the therapeutic role of being that patient's nurse at the time. And I tried talking to him, but it was very silent. There was really nothing that he wanted to talk about. And so I kind of left it at that. And I'll never forget it because I got a phone call on my way back to the ER the next day, letting me know that he was in the trauma bay because he committed suicide. So I think that my personal strengths was that I was able to talk to him, but my limitations was I didn't know how and how it would affect our relationship and how it would affect the outcome. If I would have, I guess you think of all the different things that you could have done or would have done or should have said and shouldn't have said. I don't think anyone really knows in that situation, but I think now that I've gone to school and I really sit and listen to people, I really reflect on what they say now, and I think that that's more of a strength. Before, I feel like I talked maybe more at people and I didn't listen. So there just wasn't a reflection and a therapeutic use of self at that time. So I think that now when people do talk about their depression or their anxiety, I pause and I let them talk about it and what's bothering them. And then I come up with solutions, which obviously we do as PMHNPs, which is great because I do it in family practice all the time. But I think the pause is what really saves some people from harming themselves. And you're an RN, you're trying to get through your shift, trying to be done, and you just don't know how that might affect anybody's, future, or maybe even your future. And the reflecting on the event and the interaction, I would apply what I've learned in my practice now is to pause and listen to people. So I think that when people start talking about their depression, everyone has a story. We all have things that are happening. I don't know what happened when he went home. I don't know if he got in trouble or if he got grounded. I don't think that his parents obviously had any idea because they found him on the floor the next day. So, and it was pretty awful. And they worked in the ER, so it was even, you saw the breakdown of the family and of everyone involved, even the nurses that were involved in the trauma room. So I think that sometimes we get so busy with patients and why they're there and don't really think anything of it. Like, kids do drugs, they do things like that, but you just don't stop and pause, which I think that's really something that I've learned in future practice. Thank you.